car and the rubber on your tires wear down, and the rubber actually breaks up into little particles of dust, and you breathe that in. And someone said that that is, from a cycling perspective, that is one of the negatives about cycling, is that they have rubber tires, and that also happens to bicycles. But that doesn't happen with walking. There are no harmful emissions, and the infrastructure for walking is very modest. It's rather inexpensive. It doesn't cost as much as some of the other methods, and in particular, driving a car. Next slide. Now, actually, can we go back to the other slide? Sorry, Jackie. Rodney's definition of sustainable transportation is a transport that meets our needs without compromising the ability of future generations to meet their needs. We go to the next slide, and you're going to hear a lot about this tomorrow. Dr. Catherine O'Brien's definition of sustainable happiness is not dissimilar to the definition for sustainable transportation. And Catherine's definition is that sustainable happiness is happiness that contributes to individual, community, and/or global well-being, and does not exploit other people, the environment, or future generations. And I thought it was interesting when I was putting this together to see those two links. And we are going to hear more about Catherine's work on sustainable happiness tomorrow, so I'm not going to dwell on that. Next slide. I also pulled together a few other quotable quotes. Some of you may have heard of Enrique Peñalosa. He was the former mayor of Bogota. His brother, Gil Peñalosa, lives in Canada and has an organization called 880 Cities that you may have heard of. But part of the work that the two Peñalosa brothers did when they were together in Bogota was they transformed that city from a city that was very car dominant, but where a very, very small percentage of the population could afford to even own a car, to a city that is really designed around getting around on foot and by bicycle. And Enrique's definition of a successful city is if we can build a successful city for children, we will have a successful city for all people. And I think that's very true, because if you make changes that are suitable to make a community to increase children's mobility and have them walking around, then the chances are that it's going to be good for seniors, it's going to be good for people with mobility devices, and therefore it will be good for everybody in between. I found this one as well, that parents who are physically active are more likely to have children who actively commute. So I think as parents we pass those habits on. So if we tend to drive everywhere, then our children are going to grow up being driven everywhere, and that's what they're going to do, because that's going to be the norm to which they have been exposed. And then finally, more of what you're going to hear about tomorrow, and more of Dr. Catherine O'Brien's great work in the Child and Youth-Friendly Land Use and Transportation Planning Guidelines, which I know Jacky and her team have done a fantastic job in Manitoba of promoting, is guideline number 1, which is really driving a lot of the work we do around children's mobility. In transport and land use planning, the needs of children and youth should receive as much priority as the needs of people of other ages and the requirements of business. And I think that's really crucial, because if you go back to your communities and you take a look at official plans, and you look at the transportation part of the official plan, and try to count how many times you see children mentioned, I'll bet you may not even find them mentioned once. It's as if children don't exist, and yet they make up more than 20% of the Canadian population, and we don't even consider their mobility. So just some little things to get you thinking. Now I borrowed the next one from Rodney as well. This is from Australia, which apparently is now the most obese nation on earth. This is a very recent move, one that they're not particularly proud of. This slide was put together by the Heart Foundation of Australia. And it clearly shows, and I like this slide because it really demonstrates what we're trying to do with our school travel plan model, which is all of those sectors need to be involved if you're going to have successful walking and you're going to make walking a priority. And each of these link together so perfectly, with walking in the middle. I mean, things like crime and litter, open spaces, cardiac rehab. The Heart Institute in Ottawa, they have their own Heart Institute, and they're involved in the program because Renfrew County in Ontario has the highest rate of heart disease and heart stroke of any other county in Canada. And one of the reasons they're involved in this program is because of the cardiac rehabilitation just through walking and the benefits that that has for patients who had heart surgery and need to get better and need to improve. So you can read all that for yourself. But I really like that slide because it really does do a good job of linking everything together. Next one, good. And walking is really an important freedom for children. I'm going to give you a little bit of information tomorrow about a study that was done in the 1970s in the UK that had about 80% of children traveling independently to school. And I think this is what we're getting at here. Yeah, families can walk to school, but parents today are so paranoid and so paralyzed by fear that their children they're not even walking to school with their children because they're so afraid. And children aren't being allowed to play out on the street. We're losing independent play. Children don't know how to entertain themselves anymore. And that is really quite shocking. In the UK, that study I mentioned, they talked about 80% of children traveling independently to school back in the 1970s. When they redid the survey in the 90s, they discovered that it had dropped to less than 8%, which is really quite terrible, and the number has continued to go down. The consequences of that, of course, I don't need to tell you all about this, but children's health is a big one. Childhood obesity is now a crisis in Canada. We sometimes think that we're not as bad as our American partners, but I believe we are now as bad, and in some provinces we're actually worse. A loss of independence, which I think is really crucial. You know, I love to walk, and I like the independence and the freedom that that gives me. Of course, when we hear about car ads, it's all about, you know, having that freedom. But I believe the opposite is true. I always feel, if I have my car with me, I always feel kind of tied down. Like I have to remember where I parked the damn thing, and I always have to go back to get it. Whereas if I'm walking, I don't have those hassles. It gives me a lot of freedom. And of course, parents then need to have more time. They become chauffeurs because they are expected to take the children everywhere. So we see those stickers like Mom's Taxi and all of that. Next slide. So going through this history, back in 2005, Green Communities Canada got a small grant from Transport Canada to take a look at international best practice in school travel planning, because I mentioned that the Safe Route to School program was pretty much being done by nonprofit organizations across the country who are all competing for the same amount of money, struggling for funds. Programs would do really well and then they disappear because of a lack of funding. And what we were finding at the local level, and this is particularly true in Ontario, where I'm from, is that a lot of the people that were working in those communities were doing this project off the sides of their desks. So there wasn't a lot of really good buy-in. So if a champion that you were working with, let's say it was a public health nurse, because we have a lot of public health nurses that are our champions in Ontario. If that public health nurse decided to leave her job, or they did a reorg and her job changed, there wouldn't be somebody else ready to step in. And so sometimes if you lose your champion, you lose the program. And so we were looking at ways that we could stop this. How can we start to institutionalize this program? Because by now, we've been doing this for 10 years. And we're thinking we need to really move it to the next level. So through the international connections that we made through attending Walk 21 and the International Walk to School movement, we did this research into international best practice. So we looked at New Zealand, Australia, America, as well as the United Kingdom.